Today in IMS 2023, I'm presenting the poster called Genomic and Transcriptomic Landscape of Hyper-APOBEC Multiple Myeloma. So, as we already know, APOBEC mutational signatures, SPS2 and SPS13, are one of the most important mutational signatures within myeloma, and they represent a mutation signatures that actually encompass about, I would say, 90% of newly diagnosed patients have this mutation signature. And what is interesting actually is that the way that the mutation signature is distributed within the newly diagnosed multiple myeloma patients is showing an exponential growth which shows a small group of samples, around 10%, that have very high APOBEC contribution. And most of these samples actually usually have a MAF translocation, either MAF or MAF-B, basically 1416 or 1420 translocation. So the question that we wanted to answer was basically, why do these patients with MAF translocation have very high APOBEC contribution? Why is there a subgroup within the hyper-APOBEC samples that have no MAF translocation but still have a very high contribution? And exactly, maybe what is the mechanism that causes the presentation of those high contribution of APOBEC mutagenesis? So what we did is basically use the COMPASS whole exome sequencing data along with the whole genome sequencing data and RNA-seq data. So the first thing that we did after actually looking at the mutational signatures is do the next logical step, which is basically differential expression analysis between the three groups that we define. Hyper-APOBEC with MAF translocations, MAF or MAF-B, hyper-APOBEC without MAF translocation, and of course the rest of the cohort without the MAF translocation, so non-hyper-APOBEC without MAF translocation. And we wanted to see if there is a common transcriptomic profile within the hyper-APOBEC group, that means between the hyper-APOBEC with MAF and the hyper-APOBEC without MAF. And using the differential expression analysis, we identified 534 genes that basically show a similar profile between the two groups, hyper-APOBEC with MAF and without MAF. Most of these genes, using other computational methods like gene ontology and gene set enrichment analysis, show to be associated with DNA replication, cell proliferation. So the question for us was, is this because the hyper-APOBEC samples are very highly proliferating tumors by themselves, and therefore you would have the presence of these genes? Or maybe these genes are actually what may be associated with, or maybe even cause the hyper-APOBEC signature. So using actually looking at the bibliography online, we actually stumbled around great papers by Ruben S. Harris, who worked with APOBEC for years, and they've actually have worked with mice models, and they've seen that there's actually within the APOBEC3B, which is the main gene that causes the APOBEC mutagenesis, there is a transcription factor motif for E2F4, which is an inhibitory E2F gene. And actually, what they propose is that E2F4 binds with a complex called MUV-B, which creates the DREAM complex within the G0 phase of the cell. And actually, this DREAM complex causes downregulation of APOBEC3B. So their idea is that basically you have a proliferating gene that actually, during the proliferation and the cell cycle, going from G1, SG2, the MUV-B complex actually isn't allowed to bind with E2F4. So you don't have the creation of the DREAM complex, you don't have the formation of this inhibitory complex that causes downregulation of APOBEC3B. So this causes overexpression of APOBEC3B because the cell is proliferating. And we actually wanted to see that if it's true. So we ran the next step, which was a Spearman correlation analysis between APOBEC3B and the whole transcriptomic profile of the COMPASS, the whole transcriptome of the COMPASS study. And we identified 50 significantly correlated genes with APOBEC3B, which were not just present within the COMPASS, but actually within also the ICGC breast cancer data, which Ruben and Harris, of course, use as well. And most of these genes are genes that are associated with, most of these genes are the genes that I've already mentioned that are associated with proliferation, like E2F1, FOXM1, MIBL2. All of these genes play a big role in the movement of the MUV-B complex and the DREAM complex. So, of course, just having a highly proliferating tumor, the idea is that having a highly proliferating tumor will cause high APOBEC3B expression. And of course, as previous people have shown, is that when you have APOBEC3B actually causes mutations when there is the formation of single strand of DNA, and when you have single strand DNA, of course, during replication. So that is a very nice way to see that actually proliferation causes not just overexpression of APOBEC3B, but also allows for more mutations. But of course, just having proliferation doesn't mean you have APOBEC mutagenesis, because we've seen that there are other types of subtypes of multiple myeloma that are highly proliferating but have very low or even non-APOBEC mutagenesis. So the next step was actually to see what may play also a role in this high mutagenesis. So we analyzed 141 genomic events that we've identified before with the prediction model that Dr. Francesco Mauro has shown in ASH 2022 and of course this year. Using these 141 genomic events, we tried to compare between the three groups that we found: hyper-APOBEC with MAF, hyper-APOBEC without MAF, and non-hyper-APOBEC. And we compared the two hyper-APOBEC groups, and we saw that they show a very similar genomic profile, a very complex profile that is associated with amplification 1q, 6p and 6u deletions, as well as 13q deletion, RB1. All of, and along with that, a lot of mutations within other genes like ATM, MAF, BRAF. And comparing those, we saw that they have very similar genomic profile. But comparing them with the rest of the cohort, they showed a much more prominent, complex genomic profile. And using this idea, the idea is that, at least the model that we're building, is that in order to have a very high APOBEC mutational signature, you don't need just a very highly proliferating tumor, but you need also a very complex profile. So while most groups say that basically APOBEC3B and the APOBEC mutations actually introduce complexity, what we're saying is probably something a little bit different, that highly proliferation and complexity already exists, and APOBEC actually just works within that complexity rather than the other way around.